sexual harassment in the aid sector. So I'm your moderator for today, but most of the talking and the presentations will be done by others. I think just so people are aware, you would have hopefully seen the notice at the top. A recording is being made of this. Obviously, if that's a problem for anyone, then probably just best if you don't join the meeting. In terms of housekeeping, please keep your mute buttons on unless you are speaking and presenting. We're going to have about half an hour of introductions and presentations on the study, and then we'll open it up to questions and discussion. And hopefully that will be the most valuable bit for everybody. In terms of your participation, feel free to put your hand up, and also if you want to put things in the chat in terms of questions. I would suggest that maybe we wait until after you've heard the presentation and the introductory remarks before putting things into the chat. I think otherwise it can be a bit distracting for both presenters and also for others who are maybe trying to listen to the presentation. So if that's all right, just ask people to wait for any written comments, and no need to say hello in the chat or anything like that. I mean, if you want to, that's fine, but equally maybe just introduce yourself if you're making a comment, or if you're whether you're speaking or doing that in the chat. Great. So I think that's all I want to say, and I'm going to hand over to the three representatives from the three hosting organisations, the people who've kind of really behind this report. So Mirella from ICFA, the International Council of Voluntary Agencies, Diane from UNHCR, and finally to Gareth from the Steering Committee for Humanitarian Response. So we'll hear from them, and then there'll be the presentation of the study itself, which will be led by Mary and assisted by Jerome as well. And then we'll move to the Q&A. So I hope that's all clear, and over to you, Mirella. Thanks.
Thank you very much, Peter, and good morning, good afternoon to all the colleagues that joined us in this meeting. My name is Mirella Sciutarici. I'm the Director of Policy at ICFA, and I really appreciate that we have so many colleagues joining us today. I know it's a very challenging time for all of us, but it also shows that this subject is important, especially in challenging times as today with crisis in Ukraine ongoing. So Gareth will tell you more about the reasons behind this study and what was the interest from SCHR and ICFA, and we were very glad that UNHCR could join the steering committee and support in the study, and very glad also that we had the expertise of two excellent consultants from GCPS. Just from my side to highlight that this is a challenging subject, of course. We found that it was not always easy to discuss openly about first how the PSEA allegations are dealt with in the organization, and secondly also how the partnership relations are managed during this the considerations of allegations. There were many concerns, and of course all these concerns are legitimate, but from our perspective, what is very important is not to forget why we are addressing the concerns, to make sure that it doesn't happen again in the future, and also to make sure that the persons who have been victims to sexual abuse and exploitations do get the necessary assistance and protection. Now, this study it's not perfect, we are very well aware of it. It was done in a given time. It had many limitations. So from my side, I invite you all to continue investing into looking at and how we can improve the partnership at the benefit of the support of the victims, at the benefit of making our organizations better in preventing cases of sexual abuse and exploitations. I leave it here and hand it over to Diane from UNHCR. Thank you, and looking forward to the discussion.
Good morning, everybody, and thank you, Mirella and Peter. So my name is Diane Goodman, and I'm UNHCR Senior Coordinator on Prevention and Response to Sexual Exploitation and Abuse and Sexual Harassment. Sorry, that's a very long title. And I'm really here together with my colleague, Robert Hurt, who's the Deputy Director of our Division on Strategic Planning and Results. He actually even has another title, which I won't tell you. So just shows how bureaucratic we are at the UN. No, it's really a pleasure to be here. And we really want to thank you, Peter and FCDO, for hosting today's launch, and also for your really strong engagement on tackling sexual exploitation and abuse and sexual harassment. And I really want to acknowledge the important work that ICFA and SCHR have taken, first obviously in commissioning this study, but really in providing true leadership with respect to other initiatives in this area. So we can mention the misconduct disclosure scheme, which is so important, taking on the current ISC championship together with Andrew Morley, the head of World Vision, and also the great partnership we have with ICFA on managing the PSEA Community Outreach and Engagement and Communications Fund, which is so important because it's really capacitating local actors on the ground. So UNHCR was really pleased to participate, Rob's team and my team, in an advisory capacity for the study on partnerships as a member of the reference group. The study was undertaken in response to, some of the real challenges that colleagues were facing in the field on how the partnerships dynamics can impact on how we respond to cases of sexual exploitation and abuse. So the objective was to really identify good practices, but also areas for strengthening, and propose recommendations to collectively strengthen our efforts on protection from sexual exploitation and abuse, with specific recommendations to donors, UN agencies, and NGOs. But as we say, and as Mirella highlighted, first and foremost, to better meet the needs of survivors and victims, as well as their communities. I think it's fair, we did have really open discussions. These issues aren't easy to talk about even in small groups, but even at the organizational level. So the study actually takes note of the legal and doctrinal framework which takes place, such as the obligations which UN agencies have and the UN protocol on SE allegations and the Secretary General's bulletin, and the obligations that they impose on us. At the same time, our work in this area really wants to move to one of true, genuine partnership, collaboration, and cooperation. And indeed, when our High Commissioner was championship, that was something that he really stressed, how this is a shared obligation requiring the full engagement of all humanitarian actors, effective coordination amongst them, and the strengthening capacity of all stakeholders. So, I mean, working together with Rob in the future, we're undertaking a number of initiatives. We want to hear more from you as to what we can do better, and really, make sure that we lighten your load and making sure that this is something that we're all working on together. And with that, I will stop here and hand over to Gareth.
Thanks, Diane. Yeah, so, and as Dan and Mirella have highlighted, I'm Gareth Price-Jones. I'm the Executive Secretary of the Steering Committee for Humanitarian Response. I'm delighted to be here today. So to start with, we know abuse happens. It happens in every society on Earth. It's sadly universal, and it happens particularly often in humanitarian contexts where the extreme power imbalances between those receiving aid and those providing it provide opportunities for abuse. And like all of us, I think we're all very concerned about the potential for abuse in current big responses in places like Ukraine and Ethiopia. A real challenge when we're managing sexual abuse is that it's so abhorrent that our natural instinct is to try and step away from it. And when we learn that efforts to prevent abuse, which is obviously our priority, is around prevention, but when those efforts do fail, we want to know what's gone wrong. We want to learn from that. And it's rare for anyone to respond to failure with an offer of more assistance or more resources. And that's a very human thing we see in all aspects of life. And one of the things that drove us to kind of commission this research was that we saw that this was happening, and particularly when cases happened in the full glare of publicity. And anecdotally, our sense was that although generally partnerships worked quite well, expectations were often understood, responses weren't consistent, and sometimes the way that we collectively responded would cause additional harm to affected communities. And managers facing cases amongst their staff, and this is a position I've personally been in as an INGO country director, often struggle to understand and deliver on the expectations of often many different stakeholders and different partners funding their programs or otherwise engaged or stakeholders in their programs, who often have different expectations, different requirements. And it's really, really rare for those requirements and processes and expectations to be rehearsed in advance. I think it's one of the steps that we're trying to shift at the moment is to move from a position where we assume that abuse isn't happening to moving to a position where we assume that it is and prepare accordingly. And often those details of those expectations are buried deep in partnership agreements. And because we don't tend to rehearse them, they're not well known and they're not well prepared in advance. So we felt that it would be really useful to have an objective review of where we are, where we can prepare in advance, and what we can do to change and improve. So during the course of this research, we've been careful to stay a bit at arm's length as well, because it's important that this is a tool for all of us. It really mustn't be an excuse for passing the buck to say, well, it was the other guy's fault. It's really about how do we all kind of look at this challenge together and really help us move forward. And, you know, as both Mirella and Diane highlighted, this isn't an easy thing to discuss. It's been really tough, and often there are failings, and so that makes it really difficult to talk about. So I see this research as the start of a conversation. I think as a community, as a sector, we've made a big shift in the last 4 years. We've moved particularly from focusing on how do we prevent abuse by our staff in a particular organisation towards ensuring that affected communities are better protected from abuse overall. And as we, SEHR, take on the ISC Championship this year, we're really committed to supporting all aspects of all the partners, both on the downstream and the upstream side, to better respond and resource our management of abuse when it occurs, so that we're more consistent, we're definitely avoiding doing additional harm, and we're just able to really meet the expectations of survivors and victims and affected communities, and then also donors and every other stakeholder in our responses. So really looking forward to the Q&A today and the presentation, and thanks to everyone for joining. It's great to see so many people here. Thanks. Back to you, Peter.
Great, thanks very much, Gareth, Mirella, and Diane. Really great framing remarks. So let's move on now to the presentation itself. And to you, Mary. I think Edith, you're going to share the presentation. So if you could do that now, and then I'll let that seems that is coming through. Yeah, if you can just put it onto slideshow, click on from beginning, that would be great. The second row up from beginning on the left. Keep going along to the left, further to the left from beginning. That's it. If you click on that. Fantastic. Okay. And then, okay, Mary, over to you. Thank you. You're on mute, Mary.
So sorry, that was a bad start, wasn't it? Good morning, good afternoon, everybody. My name's Mary Robinson, and I'm from GCPS Consulting. I've been a director of GCPS Consulting for about 7 years, and I'm also joined today by my colleague Jerome Conio, and so Jerome and I conducted this study last year. So GCPS Consulting is a small consultancy based in the UK, and we specialise in protection and safeguarding, mainly in the international development sector. So I think others have already introduced what this study was about, but I'd like to just go through some of the key points and share with you some of the learning from the study. So this is going to be quite a quick whiz through, and I do hope you will have the chance also to read the study if you haven't already. So in terms of the context and background, this has already been explained, that ICFA and SCHR decided to commission this research, and we're also joined by UNHCR in terms of forming a reference group to oversee the study. And it was decided that the focus would be on the response of partners during the management of SEA allegations. So we were not examining individual SEA cases. Next slide, please, Edith. Thank you. So the objective already been stated, look at the relations between partner organisations and how that's affected the quality of response and impact on survivors' communities and programme continuity, and to identify and document good practices and provide findings to inform ongoing efforts to collectively strengthen the framework for prevention of SEA. Next slide, please. This is just a quick summary of our methodology. There were some limitations, as Mirella's already referred to, but we reviewed publicly available information and documentation which was provided to us by various organisations. That included quite a lot of confidential documentation that people didn't want to share, but were kindly able to show us as part of this research. We gathered information relating to over 20 SEA incidents and situations from various different regions of the world, and we conducted over 30 confidential interviews with a range of people from different agencies, including the UN, INGOs, government donors, local organisations and private foundations. And we had obviously regular meetings with the reference group to review progress and priorities. Next slide, please. Okay, I hope these slides aren't over bright. I'll be keeping your attention with the bright purple and pink. So just to quick summary of we found very positive examples of collaborative working. So, there are a lot of good practices around. I'm not going to go through all of these, but these points here, they're taken from, at least in each case, at least one example in the report. So, for example, an INGO taking responsibility for lack of support. That was a good partnership response when there were difficulties for a smaller NGO, and the INGO reacted in terms of understanding and acknowledging that they hadn't provided the promised training, and then got involved in supporting the local NGO with the response. These are all good examples of trust, open communications, sharing resources. For example, teamwork and sharing resources. We had a very good example of an NGO agency an UN agency that had assisted again a local NGO in terms of sharing resources to enable them to respond effectively to an SEA incident. Next slide, please, Edith. So some less collaborative approaches. without again going into a lot of detail. So for example, inadequate understanding of the context, that there was an example of the examples that we were given, one particular example of a funding partner that had carried out due diligence that was conducted by some international auditors that had a poor understanding of safeguarding in the local context, and that led to a misunderstanding of partner capacities in terms of working on response or protection from sexual exploitation and abuse and responding. So again, without going into a lot of detail here, I mean, weak consortium arrangements. Again, we had an example in the development context of a consortium of agencies that had been put together, and although they developed some sort of protocol on safeguarding, it turned out to be inadequate when an issue arose, and that led to a lot of delays in the investigation and then potential ongoing risks. Next slide, please. I'm going to move on now to the key learning points. So there are, in the report, there were 7 key learning points, and I'm going to go through some of those in more detail than others, but we've picked a few that we think were particularly important. So learning in relation to partner support. We found that partnerships between funding partners and NGO partners often struggle to support partners in meeting PSEA requirements prior to SEA incidents. And this would seem a prerequisite to being able to deal well with incidents, to actually have good PSEA systems in place. I should perhaps have just pointed out that we're using the term funding partners in this report to refer to any agencies that are funding, NGOs and partners working at country level. So that may be the UN, it may be an INGO, it may be a bilateral organisation, it may be a private foundation. So we found that that partnership agreements, I mean, most arrangements have a partnership agreement. They don't necessarily fully reflect the UN Protocol 2018, which requires, joint responsibility for PSEA in relation to partnerships working on programmes at country level. And in some cases, there were poor PSEA systems in place despite long-lasting partnerships. So we found there are examples in the report of where, even though there'd been a long-term partnership between one funding partner and an NGO at country level, the systems were still very poorly developed, and when an issue arose, then they were not well prepared to respond. On the positive side, as I'm sure many of you are aware, the UN have developed a harmonised PSEA partner assessment tool, which was launched in September 2020, to have a consistent approach to addressing gaps with their partners at country level, and that's being rolled out and is helpful in identifying gaps and then being in a position to start supporting partners to fill those. Okay, next slide, please. Learning in relation to investigation. So trusting partners to conduct investigations is the appropriate overall approach, and they have the local knowledge, but making the investigation primarily the obligation of the NGO partner, irrespective of their capacity, can expose victims to harm and compromise the quality of the investigation. So again, there are examples in the report. And there are obviously risks associated with poor quality investigations that then may, lead to ongoing harm to the victim and impunity, etc. And so the best examples from this were where there had been, good work in advance to ensure that partners would be prepared. So through capacity building, through due diligence assessments. We found that investigations are mostly funded through core funding, and there's limited specific funding for PSEA. That does vary. Some funding partners do provide that, but that has meant sometimes that partners at local level don't have the resources to, do the work to the required level. Okay, I'm going to keep going on because I'm noticing time's passing, so I'll go on to the next slide. So learning about partnership course of action. So decisions by funding partners to fully suspend or terminate partner operations have not always been informed by assessment of the risk for the affected communities and properly mitigated, leading to disruption of key life-saving services and activities. We did look, in some detail at a couple of examples of a few examples where partnerships have been suspended or terminated. And learning from that is that the importance of inclusive risk assessment, mapping of available services and agreed mitigation plans to ensure continuity of services. Making sure that partners are fully consulted and communities are consulted rather than, decisions being made quickly and just by the funding partner without really considering fully the consequences. And we noted that partnership agreements, although they obviously provide the basis for terminating partnerships in the event of specific issues, including serious SEA incidents, sometimes those arrangements weren't clear to all parties, and that's an opportunity for making that clear in the future. Next slide, please. Learning on mutual accountability. So partnerships often involve unequal power dynamics, which mean that we found NGO partners sometimes feel they're expected to be more accountable than their funding partners. And some of the things that we found here in relation to, the important considerations, improving and prioritising communications, communicating well in partnerships is always, is obviously a very helpful way forward to ensure everybody's heard and there can be, equal opportunity for raising issues. So there are lots of examples of good intentions from funding partners to support partners and build capacity and knowledge together, but this does take time and resources, and that's always tricky. And we found some evidence of transferring responsibility for mitigating risks to partners and communities rather than this being seen as a joint role. Next slide, please. So a few other key learning points that I'm not going to go to in detail due to lack of time, but PSEA networks. There were lots of positive examples of where PSEA networks had offered effective avenues for joint capacity building, sharing, learning and knowledge, especially when all agencies work closely together and providing that all NGO partners become active and regular members. So there are some specific examples in particular countries where the local PSEA networks have really done a lot of good work to lead a collaborative approach and share resources and do training together. Survivor-centred approaches. So we found a lot of examples of victim assistance being given high priority, but survivor-centred approaches throughout the investigation and case resolution have probably not been consistent across organisations of partnerships. So there were some good examples and some that were less consistent in terms of that focus. And then another learning in relation to global initiatives. This is a positive learning where initiatives at global level from UN entities, INGOs and other funding partners develop harmonised frameworks and tools can translate into positive results at country and field levels. So things like the PSEA assessment tool that I referred to earlier. Examples of good collaboration from INGOs with bringing their partners together. There's a consortium arrangement that we found was doing some very good work in terms of sharing resources and working together. That's between a number of large INGOs. And then, of course, there are the resource hubs such as the UK Resource and Support Hub and a similar hub in Canada, which provides a lot of tools and resources to partners, to NGOs and others. Okay, and then finally, in terms of recommendations, the report does contain 23 recommendations, directed at all the different agencies involved, so UN agencies, INGOs, NGOs, funding partners generally, and then generally for everybody. So just a quick summary of some of the key points from those. So aligning partnership agreements with the UN Protocol 2018. So obviously this is particularly important for UN agencies, but also for other funding partners to be, in line with the spirit of the UN Protocol, even if it's not specifically mentioned, noting the joint responsibilities on PSEA. Resourcing to build capacity at all levels, and that's not just capacity of NGO partners, but capacity of funding partners and people working on their behalf as well, and to enable partners to conduct safe, professional and confidential investigations. Engaging with partners and communities to conduct risk assessments and secure life-saving activities before suspending or terminating partnerships. So this is the importance of working together and consulting with people in country when big decisions are being made. Ensuring zero tolerance of inaction without exposing victims and affected communities to further harm. That's also linked with the engaging with partners and communities, and generally working in ways which reflect a more equal approach to partnership and contribute to addressing the power imbalance between funding partners and NGO partners, and promote trust and mutual accountability. So thank you very much. That's the end of the presentation, and look forward to questions and discussion, and I hope you may read the report if you haven't already done so, because obviously it's a lot more specific than the general comments I've made this morning. Thank you.
Fantastic. Many thanks, Mary, for that, and Jerome for your input to that, and everyone else who inputted in lots of ways. I know quite a lot of people were interviewed and so on along the way and shared documents, and thank you, Edith, for the help with the presentation. So we're now going to open it up for discussion. This can take various forms. You can either put your hand up virtually, or if your virtual hand isn't working, electronic hand isn't working, then put your camera on and wave, and I'll take a note. Or put something in the chat if you want to for a question. We'll probably batch a few together, and then I'll try and distribute them to who I think might be best placed to answer out of Mary, Gareth and Mirella and Diane, or maybe some of them might be more for me, I guess. But we're very happy to take questions. I think if you're willing to and able to, maybe just introduce yourself, to say where you work or where you're coming from, and I think I'm pretty sure the answer is that the presentation slides can be shared after the meeting, so we will make sure through ICPA that is done. So thanks, Cardamon, for that question. Okay, I think that's, look, I just really encourage you. This is, as was said earlier, this is not an easy subject for all sorts of reasons. The topic itself, plus also what it means for our relationships with each other, however we're connected. But as has been said, we have to assume this is happening and will keep happening. So what are we going to do about it? And we need to talk about it, as grown-ups, even if the conversations are uncomfortable for institutional and personal reasons. So in that spirit, I really encourage you to come forward with thoughts and questions. I can see some hands going up immediately, so let's start with you, Tina. Thanks, and do put your camera on if you feel you want to. If you don't want to, that's absolutely fine. Thanks.
Thank you so much, Peter. Thank you, everyone, for producing this very, very useful report. I have a question about government partners. Was there any discussion about how to bring in government partners? Is there any discussion on doing like the national networks of the risk communication community engagement with the lovely acronym of RCCE? They actually have ministries of health as co-chairs of national networks. And I am wondering if this is being considered for all of the interagency PSEA networks. And since this report is about partners, and since it's governments who have the responsibility to provide hospitals, judiciary, etc., and since PSEA is certainly linked very tightly to the available services and access to justice in each country, I just wonder if this is a topic. Thank you.
Great. Okay, let's take a couple more questions. Thank you, Tina, for setting the ball rolling. Henry, over to you.
Thank you. This is Henry from IOM in South Sudan. My question is concerning persons with disabilities. Obviously, persons with disabilities are among the most marginalized generally, but that also I'm sure would also put them in a position of vulnerability when it comes to PSEA. So my question is whether the study looked at ensuring that access to information is or support that people with disabilities may require to report such abuses, or also what steps might be taken to ensure that they have equal access and they can be protected equally. Thank you.
Thank you, Henry. Great question. Victoria.
Yeah, good afternoon, everyone. Can you hear me? Yeah, great. Yeah, really good report, really valuable. So thank you. Thank you, especially Mary, for the presentation. So I'm Victoria McDonald, the PSEA Interagency Coordinator for Southern and Eastern Africa, and then based here with OCHA. So I've got a couple of essentially small sort of thoughts, but also a couple of questions. You know, really good to hear about, you know, the resourcing, because that's actually a huge issue. And I know it comes up all the time. So also just looking at what strategies, you know, can we actually start to, you know...
Victoria, sorry, I'm finding it very difficult to hear you. I think other colleagues might be doing the same. Do you have a microphone? Thank you so much.
Sorry, can you hear me better? Can you hear me a bit
Yeah.
better now?
Yes.
Better
Yeah,
now,
great.
yeah.
Sorry, thank you.
Sorry about that. I'm just trying to be quiet in the office. Yeah, so a couple of comments. So one of the key ones is around, you know, the resourcing. So that comes up, you know, I know time and time again, but it's really looking at like what's the next step? How can we be serious, you know, around, particularly we're looking at funding, dedicated roles, like people who've got, you know, experience in this area. So what are the next steps, you know, around there? Because I know this sort of comes up as a key issue. The other one was, you know, I was also looking at, did the report also have, I haven't actually had an opportunity to read it, but looking at prevention, because I know time and time again, and particularly working with a lot of organisations, including smaller ones, the emphasis that I'm hearing often is at the response end, which is around the investigations, and that's almost like too late, really. So what's, you know, what approaches are there around prevention, particularly focus on the design of the programs? And the other question I was going to say, Mary, because I know you mentioned that there's some examples of some good PSEA networks, and one of my roles is coordinating the network for Southern and Eastern Africa, but it would be useful as well to know what some of the enabling factors are. Like I can sort of hazard a guess, you know, why are some work well, and what can we actually learn from that, and how we can, I guess, managing all networks, make some improvements. So thank you.
Great. Okay. Thanks very much, Victoria. Some good questions there. Let's Tanya, let's take you, and then we'll take this round of questions. Thanks.
Thanks. Hi, everyone. Tanya from the CHS Alliance. Thank you so much for the report. Super enlightening. I've got three points I'd sort of from a generic sort of statement to questions. I think the way the report is phrased in terms of, you know, when we're talking about partnership, and particularly when we're talking about PSEA, the sort of power balance issue is absolutely critical to any discussion on partnership. So we were really pleased that there was this recognition of, if we're talking about the power balances, how we manage the harmonized framework, like what are we using as the common element to discuss? What are we all agreeing to in partnership? What are those common rules? What are we going to hold each other accountable to? So I sort of felt the report had made a good comment on it, and I also felt there was much more to unpick under that kind of power and balance piece, and what we're really holding each other accountable to, because that's the only way we're actually going to make some shifts in this approach. We can kind of do the nice partnership piece. The piece then linked to that, and it's no surprise that I would say this, we're kind of a little bit challenged that the efforts that we're all working on together, Peter, Gareth, Mary, particularly on the CHS, isn't recognised, which is a common framework, and many organisations have verified their efforts. They haven't even just said we will do this, they verified their efforts, and we have the PSEA index in there, which is aligned to the UN harmonised approach. So I know it was very kind of looking at the UN piece, but let's not dismiss the huge efforts that the NGOs are making on this to make sure that they are using a common framework to measure their efforts. And sorry, I know I'm taking a little while, but it was just mentioned before, I think there's an area, not just the report promotes, and all of us to unpick further, which is this capacity gap challenge around investigations. We know, and so Moira jumped on the line, it came up in the ISC external report. Where do we put in that piece around where does the investigation side in partnership arrangements come through? Who's responsible? Where's the capacity? That's where our investigations are kind of falling down, because that piece of the partnership arrangement isn't unpicked. And sorry, I am going to take the floor for one final point. Doesn't have to come up now, but again, Gareth, Peter and Mary, where does the work that we're doing around SEA common reporting come into this element? So to try and make these connections so that we can be stronger than the sum of the parts. Sorry, that was a lot. Thank you.
Okay, don't apologise, Tanya. All really good questions and points. So thank you for sharing those. We'll come to, I can see a couple, at least two more questions. People with their hands raised. I think Victoria, that's probably your old hand. But Alicia and Sion will come to you in a second. So let's take those. I think there are, Mary, I think there are some questions there around the study itself. So maybe a few for you and Jerome. So Tina's question around any involvement discussion with government partners and factoring in national networks on risk and other networks that might be relevant. There was Henry's question about persons with disability and whether the study covered that in any way and shone any light on that. And then I think probably in this Doris' question as well, around, I think, does the report contain very specific examples? I mean, I think I think the answer is quite simple on that, but I'll let you respond to that. So do you want to just take those? Do you want to just take those three, Mary, and then we'll come to another batch in a second.
Okay, yeah, thank you. I may ask Jerome to respond on this as well. I'm afraid we didn't consult with any ministries. This wasn't actually within our research plan. So good points there. But we didn't specifically look at that, other than where there are networks that may involve them. So that's a good point in terms of government partners. The government partners we consulted were really the development funding partners of governments. So in terms of disabilities, we did, and that's a very interesting and important focus. We did, one of the examples we did look at was to do with a project in Africa, which was supporting people with disabilities, and where funding was discontinued. The INGO, it was a situation where there was an INGO with an international funding partner, and the INGO actually took it upon themselves to work with their local partner to provide resources from another source to continue within that for the project to continue. But we didn't look at things like access to information. I'm afraid the study was very specific about how do partners respond, how do they work together to respond to SEA incidents. So we didn't look at some of those wider issues. Jerome, please
Thanks, Mary. I just want to add on that. In fact, in terms of the questions on government partners, where we had also to deal with the information that we could access and also the information that organizations were providing to us in the course of the research, and we were having access more to INGOs or local organizations rather than partner or government partners. So just to complete, in terms of the questions around the persons with disabilities and the steps to protect, how that link with the research, I would say that in terms of the course of actions, in terms of the partnerships and any decisions that might lead to some discontinuity or issues in terms of delivery of services, I think that's where we also have recommendations in the research that it needs to really there is a need to really engage with the communities and the beneficiaries and the potential risk in terms of the decisions that we are taking on the partnership. So I guess for the children or persons with disability, there is an increasing risk, obviously. So I would say that participation is very important, also making sure that the inclusive programming that the organizations are doing. So I also feel that there is also a kind of element of programming in response to your question, but that is not really the focus of the research. I have also noted on the questions about next steps from Victoria. I think there is and that's also a link with questions regarding the power balance between the partnership. I think we have recommendations that might be interesting to look at in terms of aligning the obligations that are in the partnership agreements with also the obligations that are stated in the UN protocol on SCA allegations involving partners. Especially in terms of addressing the gaps in capacities, because that has obviously those gaps affect the quality of the response, especially in terms of investigations. So that could be one interesting way to look at also balancing the power relations and making sure that the partners that are funding are also not only not transferring not only the budget and the program delivery and the risk associated to that, but also remains responsible for mitigating those risks and addressing the gaps. So I think that could be one interesting way. There is also, but that's not, but there is also this UN protocol on victim assistance that is being rolled out at the moment under the lead of UNICEF, and that might be also another important element. There was some good practices in terms of collaborations to provide assistance to victims. That's what we've also been documenting in the research. And maybe one setting that is interesting to look at is the interagency PSEA network that exists in the different countries, especially when there are big emergencies. And we have found, in some of the feedback we had during the research, we found that organizations who were affected by an incident were having received quite some, the support that they were having received, they were having received it from the interagency PSEA network sometimes. So that's a good practice, and that also may be something that we could look at collectively. How can we make those networks even stronger in the future, and making sure that all organizations, especially the national organizations, are also members of those networks. There is one next step also that maybe I see, and it's around investigation. Or at least this is a field that we really need to look at probably as a sector. Because we have had also examples during the research of organizations who were having very weak experience or expertise in conducting investigations obligations, but they were having the obligations to do it, and sometimes they were not receiving all the support that they would have needed. And I think this is really a concern in terms of the assistance and the protection of the victim, and also in terms of the the results of the investigations as such. It's a real difficult field, investigation, and we have colleagues from CHS Alliance, with Tanya, who's CHS Alliance delivers training globally on that. It's very difficult to find the real expertise. So one recommendation is that we should not be giving the responsibility of conducting investigations to organizations or staff that are not trained. It could be really counterproductive, and that might be an element of a next step for us collectively. In terms of the questions Victoria was having in terms of prevention, I've noted one question. I would maybe say, and please, Mary, you complete, and also Garrett and Mirella, but standard compliance to standards, that's a big challenge, I would say. And we now have some very nice tools, like the UN harmonized tool on assessing partners' capacities. And we have also some guidance from donors, the FCDO, but also IDCO has new guidelines on PSEA, etc. So we should be looking at how to ensure a real effective support to organizations to comply with the standards on PSEA, with probably a focus to national organizations. That's also something that we felt in the different consultations we had. What about the national organizations? Actually, we had some kind of challenge to connect with them. We had a lot of interviews with INGOs, with UN agencies, some with national organizations, but it's still, I think, a priority in terms of the organizations really to support.
Jerome, can I stop you there? Thank you. That's great points. Can I just move on? Just actually, Mary, maybe it's for you, or Jerome, just one other point before we go on to some of the more substantive issues, and I'll come to Gareth and Mirella, and Diane, you might want to come in as well. But just on, can I just ask this point that was raised about the core humanitarian standards? So that Tanya raised, and the fact that that doesn't seem to feature anywhere. Just be interested to just your thinking in terms of kind of framework of the study and what was used and what wasn't.
Okay, thank you. Well, I think in the appendix to the study, there is actually reference to the work of CHS Alliance and the core humanitarian standard. But I mean, I completely accept that it wasn't, a big part. It was one of the, reference documents that we referred to. Yeah, and I mean, in relation to the current CHS initiative on Common Reporting Initiative, which obviously Jerome and I are involved with as well, that when we did this report on last year, that was before that initiative got going. So I did wonder about mentioning it this morning, but it seemed like I'd be touting for information for another study rather than really reporting on this one. So, but you're absolutely right, of course, there need to be links between the different initiatives. And I think you also you talked about who's responsible for investigations. I mean, I think, the overall conclusions from this study and, in terms of general good practices is actually, the partner at country level, it's their responsibility to undertake an investigation. And we've had, good examples of, some funding partners who do very extensive due diligence and actually don't perhaps don't give money until they ensure that they're sure that partners are able to take on those responsibilities relating to PSEA. So, you know, ultimately that's the work should be done at the lowest possible level. But as Jerome just mentioned, then if there's an assumption that a partner is going to undertake investigations and actually they don't have the capacity or the resources, they aren't trained, then that obviously isn't the right approach, and that's an area where more attention's needed. But to move it to a stage where people, you know, at that local level are able to do it, that has to be the right way.
Okay, great. Thank you very much. Before we've got more hands up, so I'm keen to go to more questions from people who've got their hands up. But Gareth, Mirella, Diane, before I do, any kind of quick reflections you want to come, any points you want to come back on that you haven't already answered in the chat? Gareth, go for it.
Yeah, a couple of very quick ones. Thanks, Tina, for flagging again the kind of host government. Obviously, their role is critical in kind of prevention and in terms of following up. So we didn't involve them there. I think we are talking, for example, to the Group of Friends, which is a member states grouping that looks at that includes kind of hosting states, affected states. So, but limited engagement so far. So I think that's really important to continue flagging that, particularly as we get this shift from preventing abuse by our staff to the wider preventing abuse of affected populations. Victoria's point, I thought on resourcing, I think that's one of the reasons why in the IC Championship we're trying to shift this framing away from the idea that abuse is occasional outliers to recognizing that because of those power differentials, it does happen, and therefore we need to kind of work through what do we do when it happens, and rather than just kind of, you know, doing our prevention and holding our fingers crossed and hoping that prevention works. We know that it's not going to work in every case. So, and you'll see that in this shift of language away from kind of talking about zero tolerance, which suggests we'll have no cases, towards zero tolerance for inaction, and being very clear that actually what we're not tolerating is people covering this up, pretending it's not existing, those kind of elements. And then, yes, completely agreed with Tanya's points. And I think also, yeah, there were some good points Hannah and others had made in the chat. I think, you know, what we're trying to get is, as I say, this culture shift that we'll be working on over the coming years, because it will take time, to just be much more realistic. And so then it becomes a leadership expectation that if you're running a humanitarian response, you have to be prepared with this. You have to be clear how you will respond to survivors in affected communities, how you will work with your partners. And I think that's an important shift that will mean that we get much better at doing this in the coming years. Thanks.
Great, thanks for covering various points there, Gareth. Mirella, do you want to come in at this point? Or if not,
well, maybe about the survivor-centered approach, because this is something that is coming a lot in the chat box, and it's a crucial point. And it comes a bit in the study, but it was not the focus of the study in itself. And actually, I would very much support some further work done on how the different organizations interpret and implement the survivor-centered approach. And I'm sure that we'll find that we don't have a consistent approach in there. Colleagues of UNHCR are with us today, and I know they have invested a lot into a survivor-centered approach and also supporting their partners in this direction. But it would be very interesting to have discussions with NGOs, for example, and other frontline organizations to see what are the concrete challenges in ensuring a survivor-centered approach. Again, unfortunately, it was not the focus of the study. A very good point made about Tanya and about the core humanitarian standards. I think this should have been better highlighted as a tool guiding all the NGOs' actions around PSEA. I think the fact that it didn't come so strongly forward is linked, Tanya, to what you said, the power relations. I think the NGOs feel so much under pressure in their relations with their partner agencies, their donor agencies, that they look at the dress and the response to allegations more from that perspective sometimes, unfortunately, rather than from the perspective of, how to do it better for ourselves. And I'm not speaking about all the NGOs, because there are many who are really advanced in these areas and have been investing for years and have very safe standards and procedures in place, the staff that is really well resourced and has the expertise to address and even to prevent and then address allegations. But this is not the case for all the NGOs. And there are some who really panic out when allegations occur. And sometimes, unfortunately, the way that the partnership relations are managed in these cases does not help them to address allegations and does not help the victims and the communities. Thank you, and over.
Great. Okay. Thanks very much, Marilla. Let's move on. Diane, if you want to come in quickly, then do, and then I'm really keen to we've got 4 hands up for the next set of questions, so go there next. But Diane, if you want to come in quickly.
Yeah, super quickly, on the prevention point, which I think was really important. Again, I mean, I agree with what Marilla said. This was really looking at the partnership management aspect, but we do have that great project with ICVA that looks at supporting local NGOs for community outreach and engagement, which I think is really a critical, I mean, it's just one of many, but really working with those grassroots NGOs. I fully agree on we have put a lot of effort into the victim centered approach. I can put in some links to our policy and definitions, but just to mention that is a priority of SCHR's and World Vision's championship to get an agreed common definition for humanitarian actors. So I think it's a great priority and will really help us move forward together on that.
Great, thanks Diane for covering those points and concisely. Right, let's go to the next 4 hands that are up. Alicia.
Hi everyone, this is Alicia Nissan from World Vision International. Thank you, Diane, for first of all taking the words right out of my mouth that this is a championship priority in the coming year, specifically to address what does survivor-centered look like. So you've said it all there. The power dynamics that Hannah mentioned in the chat, they extend much broader than even what we see between humanitarian agencies and communities. As we know, funding agencies have a lot of power, and that then trickles down. So one question probably for Peter is, I know that there has been a lot of discussion around better harmonization among donors on what they're asking for. As someone who is operating in this every day, I haven't seen any impact of that effort yet from where I sit. Quite the opposite, it has proliferated just in recent months. ECHO and EU being great examples, each one of them asking for extremely substantial, detailed, and prolific reports from us, due diligence assessments that go beyond what we've done in the past. So it's not getting any better yet. And as mentioned, core funding is primarily how we're addressing PSEA and safeguarding. So the more that we have to divert those resources to address donor issues is less that we then have available to do field-based work out of core funding. So there's a real tension here around, even in an agency that is well-resourced, that does have expertise, we're limited in a handful of human beings operating at global level, trying to address with best practice all of these donor demands. Another way that power dynamic comes into play, if it's interesting for anyone, is World Vision recently removed the term beneficiary from our safeguarding policy and our guidance, instead to talk about people, adults living where World Vision has a programming presence, adult program participants, any child, anywhere, to more humanize that. Last point, I'm not sure if this is well captured in the partnerships piece, but we're struggling also with the difference between criminal and non-criminal PSEA violations. They have to be managed very differently, and so far as a sector, we call it all one thing, and yet the way that we respond to each of those is very different. Thank you.
Great. Thanks very much, Alicia. That's really good points there. We'll come back to those. Emmeline.
Thank you. Sorry. Thank you. My name is Emmeline, and I work as the PSEA for Partnership Coordinator with UNICEF headquarters. So thank you for the report. It was definitely really helpful. UNICEF is currently in the process of revising its PSEA procedure as part of its 2-year cycle. So the lessons highlighted in the report have been identified as a key priority, especially around partner strengthening of capacities, adequate response and measure taken following SEA investigations. On the interagency aspect, I want to share that a lot has been done following the development of the UN Common Assessment, and a lot of work is ongoing to support a harmonized approach to all aspects of SEA risk management in partnership, and that includes capacity building, monitoring, investigation of SEA allegation, and also partnership response to allegations. So everything around suspension and termination. On suspension and termination specifically, I noticed that program criticality was not included as a factor in decisions about whether to continue partnership, but that is in fact a factor that is considered to make decisions, and it is part of our guidance to country offices. One more particular concern that we had is the way suspension and termination of partnership is framed in the report. It makes it look like it's about either holding an organization accountable for SEA or providing assistance to population in need. For us, it's really not an either or. It's really a both. And ensuring accountability and adequate action for SEA allegation does not contradict the provision of assistance to affected population in needs. In some cases, partnership suspensions or termination have been considered required due to the level of risk that the partnership represented for the affected population and for organizations, and because non-action would have been the wrong approach. Thank you.
Great, thanks. I mean, really interesting points there. Claire, I think you're next.
Yes, thank you. I'm a colleague of Emmeline. Actually, I work with the HQ PSEA team, but I'm on the programming side also for UNICEF. I just wanted to react in response to also the discussions in the chat about the victim-centered approach, just to say that and point out that UNICEF has produced a technical note on the implementation of the victim assistance protocol and is now engaged in the rollout of the technical note. So with the objective, obviously, to support UN country team, humanitarian country teams, but also field practitioners on the operationalization of the protocol. So basically, to go back also to the discussion on the concerns raised on how to implement a survivor-centered approach during the investigations, for instance, which is one of the points that is raised in the report. The technical note, for instance, provides specific recommendations on the implementation of the do no harm approach for children's participation in accountability processes. So that's investigations. So I will put the link in the chat, also in as a complement to the policy that Diane included. And yes, just also to say that we are continuing to roll out this technical note. We've already been training 900 people on the UN, PSEA coordinators, donors, and also NGOs side. So this is still a work in progress. Thank you.
Thanks very much, Claire. Really helpful. Seong.
Hello, this is Marcelino from Good Neighbors International. Having come back from the Romanian-Ukrainian border, I have some practical question that I would like to actually listen from our presenters concerning, in condition where you have ad hoc or short-term kind of relation with this partner, and especially if this partner, which were local NGO, which were never exposed to the discourse of PSEA, what would be, the essential tools or the basic tools that you might present before getting into the relation? In fact, we were trying to establish child-friendly spaces with psychosocial support. Even child rights-based organizations down there were not that much exposed with the concept of PSEA, and it's very difficult to, get into the dialogue of really putting that as an item. They were really reacting like, are we potential, perpetrator, etc., etc. So I think that it would be very good to shed light also to preparing, these very quick tools that can be easily implemented, not in a long-term kind of relation, but also in the context of emergency, where you have to persuade and work with short-term contract and short-term relation with other entities. Over to you.
Great, thank you very much, Marcelino, and apologies for getting your name the wrong way around. Let's take two more, and then we'll come to those. Wendy, over to you.
Thanks so much for the presentation and the discussion. Whoops. I wanted to ask how some of these recommendations, maybe more for the organizers of and sponsors of the board, how we would ensure these recommendations are prioritized and taken forward. As you all know, we're working on hopefully a multi-year strategy from the Interagency Standing Committee for Humanitarians to coalesce around some priorities. The champion has already referred to those priorities they'll take forward, and some of the recommendations in the report really dovetail nicely with the priorities we've agreed. But anyway, we can kind of mutually reinforce the findings of this report and feeding into something we'd like to take forward and have the resources and commitments to do so would be really grateful. Thank you.
Great, thanks very much, Wendy. Links back to an earlier question, wasn't there, also about resourcing for on this, which I'm not sure we quite tackled, but we can come back to it. And finally, before we answer those, Mayumi.
Hi, thank you very much for this. So I'm Mayumi, and I'm the Global Accountability Lead at Islam Relief Worldwide. I'm currently taking a study leave to do a PhD research on accountability in the context of PSEA. And I just wanted to follow up on what echoing what other people have already said as well, but in terms of around the report, focusing a lot on the response, but not so much so on the prevention side of this. And just wanted to sort of raise this that all the persistent challenges that we have been identifying is the underreporting of cases. And I just wonder where does this the role of interagency complaint mechanism that's been developed by IASC PSEA network has developed, and where does this interagency complaint mechanism can fit in coordinating and building this partnership among the implementing partners to collect the case, to collect the reports, follow up and respond to these safeguarding cases. Because I think the major point of cases, the concerns is that the victims do not feel comfortable because they don't want to report back to the agency of the stuff that they've been seen as the perpetrators. I think that's so. Just wanted to emphasize about the role of interagency complaint mechanism and where can this then fit into your upcoming work as well. Thank you.
Really valuable point. So look, I think we're probably going to close the questions now. Obviously, if people want to put more things in the chat, then feel free to, but I think we won't have time for another round of questions. I think we have covered everyone. No one's left hanging. No, fine. So let's just leave it there. Apologies if you've got burning questions, feel free to put them in the chat or follow up afterwards. So look, there's a real range of things there, but maybe I don't know, Gareth. There were a few things there linked to the ISC, review and the 5-year plan, and sort of various things that are going to likely to happen in the championship. I think we've sort of touched on a few of those already, but I don't know if you want to go first on any of those or anything else. I mean, and also, I mean, I think any of you could perhaps answer Marcelina's specific question, but maybe you want to take that one as well. Thanks.
Yeah, so really I want to pick up on Claire's point from UNICEF, and also the it's come up several times in the chat as well about the victim survivor centered approach. And for me, what's important there is that this is much bigger than victim support. Traditionally, we've seen that around kind of victim support services. But actually, I think this is something that's really relevant to how partnerships work, because it really shifts your thinking if you're switching from thinking about a partnership working for the parties to the partnership, so that maybe the donor and the NGO or the UN agency, and think about, okay, how we manage this really support victim survivors to get a better outcome for them, which when you talk to victim survivors, overwhelmingly that's about how do you protect other people. So it links back to the point about prevention as well. And often the best prevention is identifying and taking those abusers out of circulation. In terms of Marcelino's question, it is really tough. This can be quite technical, but one of the things that we really want to do through the championship and previous ISC champions, UNHCR, UNICEF and others, UNFPA have really done, is highlighting that SEA, prevention of SEA is everyone's job. It's a leadership issue, it's a management issue, it's a colleague issue right across the whole board. So hopefully we're moving away from that very technical acronym heavy stuff to more understanding, particularly on the Ukraine response. One of the things I would highlight is that there has been a network in Ukraine for the last 2 years, and they're still operating despite the incredible challenges they're facing. And we have Ukrainian colleagues who are working on this, and Wendy and others are very well connected to that. Another area where it might be more useful to frame it for colleagues in the region is around trafficking. So IOM has done a lot of anti-trafficking work in the region. So there's a lot of already translated materials and framing there. And then the last thing, and this links into kind of questions about the community-based complaints mechanisms and how those work. So they're not a priority for the championship, but they will be in the strategy, and it's something we're looking at supporting. But I think one of the things for me is, and this is why I think it's so important to shift our framing from this is something that occasionally happens and we react to it. We're much too reliant on survivors themselves raising complaints before we take action. We don't need that. We already know that abuse is happening. We know what actions we need to take. Now, there are obviously, to specifically respond to a particular abuser, we need those individual complaints. But we know that abuse happens. We can take most of the preventative steps beforehand, and shifting our framing so that we're not reacting, but we're much more proactive, I think will really help us in the long run. Thanks. Back to you, Peter.
Great, thanks, Gareth. Diane, you've got your hand up, so do you want to come in on anything you've heard, or over to you?
Yeah, just very quickly. Yeah, thanks very much for the colleague for looking at who was at the Ukrainian-Romania border and looking at how we quickly do a realistic awareness and capacity building up for the small new NGO partners. And just on the Ukraine emergency, in case any colleagues are going out there, sending colleagues out there, we do have 4 dedicated PSEA coordinators in Poland, in Romania, now in Hungary, covering Slovakia, Slovenia, and Czech Republic also, and in Moldova. So if you're interested, I will put their contact details in the chat, and please feel free to reach out to them.
Thank you very much, Diane. I mean, I guess it might just be worth adding there are various, obviously, basic introductions to the topic as well online, whether they're in video form, whether they're in pictorial form, which you can find on the Resource and Support Hub. You can find on the IASC website, I think, as well. There are things that you might just want to have a look and see what might make sense. I know language might be an issue, but hopefully some of those might be useful as a very basic introduction to what we mean. Mirella, do you want to come in on anything at this point?
Peter, thank you very much. I think I will leave my my comments for the end so that I do a sort of a wrap up. Okay, great. Jerome, Mary, do you want to come in quickly? I need to answer a couple of questions as well, so if you can just be brief, but do come in. Jerome, you had your hand up.
Yes, thanks. Just on the issue of quick response, like for the colleagues in Ukraine, I think it's also something that, in general, that we take as an object of thinking for the organizations, but also for the donors. How do we plan our rapid assessment? Are we ensuring that PSEA experts are also part of the rapid assessment team, and that there is a programming that includes PSEA perspective? I think this is very important, because there are examples from the past where PSEA has not been included from the right beginning, which ended up in exposing potentially some of the vulnerable people from the community. In our research, there was also the examples of rapid response and establishing or setting up community-based organizations and empowering them. And the founding partners were ultimately facing some issues in relation to sharing values, in relation to really understanding from the staff of these organizations what PSEA means. In spite of PSEA focal points going there and training them or raising awareness on the PSEA policy. So there is a need of constant ongoing support, ongoing awareness to make sure that the staff of those organizations are also sharing the same values. And it ended up ultimately with also a PSEA incident. So that was really a good learning. On the issue of, I would say, in partnership course of actions and the risk on PSEA versus the risk on communities. I think the reports highlight very much the need to really take some strict and disciplinary measures and real actions, especially when organizations are breaching their contractual obligations to report any incidents or to really fail to conduct investigation on a timely basis. So this is really understood. What the report also says is that it has observed that sometimes organizations who were facing incidents and who were having very weak capacity were in partnership with funding partners for quite a number of years. And so it questions also the ongoing support throughout the partnerships for those organizations to build up their capacities. And it has also highlighted the need to balance with the risk with vulnerable people, when sometimes the course of action discontinue the life-saving services. So yes, that's what we mean in our reports in terms of balancing risk on PSEA versus risk on vulnerable communities.
Okay, brilliant. Thank you, Jerome. Right, so just let me just, so I'm not accused of avoiding difficult questions. So, Alicia, on your questions, I haven't seen, I'm aware of, I haven't seen the EU ECHO documents. I mean, I can get hold of them from colleagues there, but be clear if you want to share them, I'm happy to look at them. It sounds like a step in not in the right direction. I wish the UK could influence the EU a bit more, but unfortunately we can't, or less than we used to be able to. But we will definitely continue the conversation, and we are continuing a conversation amongst donors about streamlining and with the broader community about overall international approach on tackling sexual exploitation, abuse and harassment. I still think there is a lot of scope for a more streamlined, aligned global framework approach on all of this, which it's not going to be easy, but anyway, and I know it's not necessarily the right time to be talking about it, but we're very aware of that. On the funding point, just to continue to reiterate, I totally get the point about core funding, and we know a lot of the work does come out of core funding. If you need funding for stuff, ask. I mean, we're doing all of the central funding for things like the Resource and Support Hub, the support for training of investigators, etc., etc. You know, we're bearing those costs, but recognise for specific things, if it's related to a programme, then do ask us that we're funding, either before, preferably as part of the proposal, or it might need to come later. I know that you are also talking about things which may not be related to any specific programme, but I think, you know, let's continue that conversation about how donors can make sure that organisations do have what they need on this. I will leave it there. Thank you all very much indeed. But let me just give the final words to you, Mirella, to close up. Thanks.
Thank you so much, Peter, and thank you to all the colleagues for this very useful discussion. Lots of interesting points made, so it's difficult to wrap up, but maybe a few points I wanted to highlight from this discussion. First, the need to invest further in organizational capacities to be able to prevent and also respond to incidents of sexual abuse and exploitation. This is clearly something where we have to do better in the future together. The second point, the power relations. It was mentioned by many colleagues. We have to make sure that we find a better balance in our relations and the division of power. And what is important is that we are also very predictable about rules, processes, and outcomes. It has come out during the study that people are sometimes surprised when certain measures are undertaken, why they are clearly part of a contractual obligation signed by both parties. So it shows that sometimes having a piece of paper with contractual obligation, it's not enough. We really need to sit together and discuss what is behind words and how these words will be interpreted in specific situations. The point of communication, they are all linked, of course, but communication, we need to be good in communication, which means communicate without hesitation to our partners where allegations come. We need to be frank and open in our communication, of course, making sure that we protect personal data. The other point, when organizations do not duly address allegations and there is impunity, of course there need to be considerations of other measures to be undertaken. But this should come at that time and not in advance. I had also an exchange with a colleague in the chat box saying, but we see that the partner is not ready, so there is a risk for us, so we suspend the contract. Many organizations would find this not the right way to go forward. If there is a risk, invest in the partner's capacity. Make sure that this partner would be able to respond better, not just terminate the contract. And why this? Because it is in the interest of the communities and it is in the interest of the victims and survivors. And this point came up also very strongly from this discussion, that in the partnership in the future, we have to do better also in terms of victim and survivors assistance and support. And this brings me to the last point about the next steps. And thank you for asking very clearly about next steps. We didn't know how the report would be actually welcomed by all of you, but it's clear now that there is expectations to follow up. We are glad that some state agencies were present with us today, so we hope they will follow up. We hope that the UN agencies that were here today can also follow up on this report. We have the privilege to have World Vision and SCHR as champions within the EASC. So this gives us another opportunity to ensure follow-up. And the SIGVA will, of course, make sure that in the various consultations that we organize between NGOs and UN agencies or NGOs and states, this element is included. That's all what I can say for now, but for sure looking forward following up on this important subject, and thank you again. Over.
Okay, thanks very much, everyone. Apologies, I think we've had one more hand up, Samson. I think we're over time now and people are having to drop off, and I'm afraid I've got to go to something else as well. But thank you very much again to the authors of the report, everyone who contributed today, everyone who contributed to the report and the study. Loads of huge food for thought there, and it's part of an ongoing conversation, as has been said. So I think this is really, so let's keep working on it. Thanks everyone. Have a good rest of the day. See you soon. Bye.
Thanks, Peter and all. Cheers.
Thanks. Bye-bye.
Thanks, everyone. Bye.